Hi, my name is Sydney Hyatt, and this is my oral presentation for my SOAP note this week. I did a SOAP note on Candidiasis for a geriatric patient. SM is a 69-year-old African-American woman who is in the office alone today. Her date of birth is 3/31/1954, and she is on Medicare as her primary insurance. She appears to be a reliable historian. Her chief complaint was, "I've been itching bad down there." SM presents in the clinic with complaints of vaginal itching. Itching started about 10 days ago and has gotten progressively worse. She says it sometimes will hurt when she urinates as well. She says the itching comes and goes, but nothing seems to make it worse or better. She has not tried anything treatment-wise and rates the severity as mild to moderate. She does have pre-diabetes in her history, as well as seasonal allergies, no other issues. She's up to date on her immunizations. She's up to date on her screenings. She's had no notable surgeries in her history or hospitalizations. Only seasonal allergies, no allergies otherwise. She currently takes metformin 500 milligrams QIDPO for prediabetes. Occasionally she'll take Pepcid 20 milligrams oral PRN when she gets reflux. We discuss supplement and vitamin usage, and she denies use one of those, but she does use hormone replacement therapy with a local specialist, does pellets of testosterone and estrogen, and then an oral progesterone. She's unable to tell us about dosing. No notable family history that's applicable to the case. No history of substance use. Her husband's deceased and she is not sexually active, so no concern for STD related problems. She is retired, follows good safety habits, feels safe in her home, is living alone currently, reports having a healthy diet and trying to control her carb intake better since getting her prediabetes diagnosis. When going through the ROS section, the patient stated that she's steadily been gaining weight since she was perimenopausal. She denies fever and chills. Denies any cardiac or pulmonary symptoms. Does not appear to be anxious or depressed in office today. She's gained weight gradually, but feels it's been related to menopause, and denies changes in heat and cold sensitivity. For skin issues, she reports some redness of her vulva and perianal area. The rash is itchy and sometimes burns. It is reportedly red and slightly inflamed. She reports burning and itching of the perianal area and also reports a thick, white, odorless vaginal discharge. For the workup, lab work, we did a UA with reflex culture for leukocytes and nitrates. It was negative for leukocytes and nitrates. Did a fungal culture of the vaginal discharge, which was positive for Candida albicans. We did a pelvic exam, which was normal. Did note the red vulva and the discharge. Normal exam otherwise, no goiter. Skin assessment done of pelvic area. Differentials that were considered for this patient were a UTI, because burning with urination is a common sign of UTI. A urinary analysis was collected to rule this out. Urine came back negative for leukocytes and nitrates, making it unlikely that this patient has a UTI. Often UTI patients will also present with increased frequency and urgency, which was not present in this patient. Another differential is bacterial vaginosis. Bacterial vaginosis or BV is a very common condition that is related to disturbance of the pH of the perianal and vagina, periarea and vagina. Similar symptoms to yeast infections, they can both cause vaginitis. Patients with BV may experience redness, tenderness, inflammation of the vulva, as well as itchiness. These are all present in patient SM. If the patient had BV, the fungal culture would not test positive for Candida albicans, therefore this was not the supported diagnosis. The main supported diagnosis is Candidiasis of vulva and vagina. Common symptoms of Candidiasis of the vulva and vagina include itching, soreness, and burning with urination. Candidiasis is less common in postmenopausal women. However, this patient is doing hormone replacement, including estrogen, so she's at an increased risk of infection. Patient reported that vaginal discharge was odorless and thick white, which is indicative of candidiasis. A sample was taken of vaginal discharge and sent to the lab for fungal culture. Culture ultimately came back positive, and Candida albicans is the most common yeast infection. The patient should be treated empirically prior to culture results. Plan moving forward is to give the patient fluconazole 150 milligrams PO tablet one time only. No diagnostics need to be done. Education was done on the potential for one more dose if symptoms don't improve. Education also done on potential GI effects such as nausea and vomiting. Education done on how estrogen can increase risk of yeast infections, and hormone replacement therapy is not typically necessary at her age. No consults were recommended at this time, and she is recommended to follow up if problems come back or if problems don't resolve within 2 weeks. She should also go to the ER if she has any kind of allergic reaction to medication. Thank you.